podcast. I'm your host, Stephen Rogers, Doctor of Medical Science, PAC, joined as always by my co-host, Christopher Stone, Doctor of Medical Science, PAC. This is a podcast talking about health, wellness, current events, sports, culture, and everything else we feel like talking about, all from a physician associate perspective. Check us out on Instagram, Campfire MedPod, on YouTube, Campfire MedPod, and then wherever you get your podcasts, Apple, Spotify, etc. Thanks so much to everybody on the Instagram channel for signing up and following us, liking us, sharing us with your friends. I'm sipping on my coffee here in my Yeti mug. It's keeping it nice and cool. We have another one that we'll be sending out with some more giveaways coming up. So be on the lookout for that. Seems to have gotten a lot of people's attention, Chris. It turns out people like free shit.
I don't think that mug works very well. If it's keeping your coffee cool. Are you having iced coffee?
Well, it's iced coffee. Yeah, sorry. I should clarify that. It's iced coffee, but it turns out people like.
Yeah.
Turns out.
Yeah. Well, who doesn't? I like free stuff. Come on.
Yeah. So, a couple of things to talk about today. First and foremost, kind of an important subject. It is National Patient Safety Awareness Week. Patient Safety Awareness Week, and so a lot of hospitals and health centers and health entities are celebrating that. Part of that is highlighting suicide prevention and suicide awareness. And so that's something that kind of caught my eye that I thought we should highlight today. The biggest thing is just letting people know a couple of things. One, there are resources, so you are not alone if you're having thoughts of suicide or if you're dealing with that with someone else that you know, a friend or a loved one. Make sure that you talk about it, and then there are other people that are available to talk to you about it with you. The National Suicide Hotline is 988. You can text, dial that, and call it. There's lots of different ways to get a hold of them. They're open 24/7. So just make sure if you feel like you need to talk to somebody about it, dial 988. Just some statistics on why this is relevant, Chris. So I'm looking at the CDC's website, and their latest confirmed data was in 2022. 49,000 people died by suicide in the United States in 2022. That equates to one death every 11 minutes. So that's pretty significant. Obviously, it's one of the leading causes of death in the United States. I think the other thing that was pretty surprising to me, if you look at some of these other numbers, so 1.6 million people attempted suicide and were unsuccessful. 3.8 were bad enough to where they made a plan. 3.8 million. And 13.2 million people admitted to having serious thoughts about suicide in the year 2022. So 13.2 million people. That's a lot.
That is a lot. Yeah.
So it's obviously something that's affecting multiple people in multiple communities across all spectrums and all socioeconomic statuses and demographics. So biggest thing, just be aware of it, talk about it. It's sort of a taboo thing, but there's good data that shows that if you talk and are open about it, people do better. And then dial that 988 number if you or anyone else you know is experiencing some sort of crisis. Emergency departments, for better or worse, end up being a big resource for people in crisis as well. So make sure that if you or a loved one is experiencing anything like that, you need to reach out and get that addressed and take it seriously. Anything else to add on that, Chris?
Just some small little anecdotal things, like the 3 C's of suicide prevention: connection, collaboration, and choice. Connection implies a person has in a crisis, they're feeling understood and not isolated. I feel like that's a big part when people are having a deep depression or into suicide. They're really ruminating on something. I feel like that's another thing. But they ruminate on their thoughts, on their own thoughts, and they don't get to talk to somebody about them, and they feel alone. And they feel like this is really the only way out. And so really finding a way for them to connect or collaborate with somebody and help them make a better choice than suicide. And then also there's the 3 R's framework, which is to recognize, respond, and refer. If you notice a friend of yours who's having a tough time or not doing well, I think it's easier to note like that women are a little bit more, I guess, easier to tell if they're not in a good mood, where you'll have a lot of men that don't get, we tend to just bottle everything up, be like, okay, we're going on with our daily life. And you might not ever notice that they're having struggles just because they're not outwardly expressing it as well. I don't know, those things.
Yeah, I guess understanding the difference between males and females in society as part of a cultural thing where, it's maybe not as acceptable for a male to show emotion or wear his emotions on his sleeves, whereas sometimes females, it's a little more acceptable for them to be a bit more expressive.
Mhm.
So recognizing that difference and understanding the difference, I think that's a good point. So yeah, okay. So there's some frameworks, there's some things to remember: the 3 C's and the 3 R's. Biggest thing is, reach out. The 988 number is a huge resource. They can help guide you locally as to where to go in your specific area. So just wanted to bring people's awareness to that. It's all part of
Yeah.
patient safety, which is hopefully kind of the backbone of what all of us are doing, is trying to help take care of people in a safe and effective way. So
Yeah.
wanted to
Do
bring
you
that up.
Yeah, do you remember when, gosh, I feel like it was years ago when there was a tattoo like the semicolon. Do you remember people started doing that for suicide prevention?
Yeah, so I got some like free giveaway bracelets at my work, and they have a big old semicolon
Oh,
kind of like right
nice.
in the middle there, if you
Yeah.
can see it, with like a little EKG ticker. I
Yep.
don't know. Talk to me. Do you know what that means? I don't know what that means. I haven't paid attention.
Just when it came out, that it just started to keep people started just using it, being like they didn't feel whole. It's just dedicated to the support for those who were struggling with depression, suicide, and addiction. And then it just kind of took off on social media, and people were starting to use it just to create more connection. I think it is used in some other platforms as well, but it just, if you are having struggle, people are like, oh, it's an acknowledgement to other people that you've had some mental health issues like depression, and so it gave people a way to connect without having to outwardly go be like, hey, I've got depression over here, I
Yeah,
need to talk to
right.
someone. You could just see
Not
it
maybe as
on there.
overt.
Yeah, exactly. So I think that that's
Gotcha.
kind of how it came about. I've seen it used in other medical things as like Crohn's disease. They'll also, if you have a whole colon, they'll have the colon, the semicolon, because they often get part of it taken out.
Uh,
So I've seen
that's
that.
pretty clever.
Yeah, I thought that was pretty clever as well. Yeah, again,
Okay.
that's a terrible side of things as well. Crohn's disease. That's a tough thing, especially if you have to get your colon, part of your colon, or all of your colon taken out, for that matter. But yeah, suicide prevention. That's a whole nother. This,
So 988, text or call if there's ever an issue. They're open 24/7. They have specialists that deal with this stuff all the time that are there for you. That's the big thing to remember. Oh, okay. So next, kind of moving on from suicide, but something that I think is relatively related: substance use disorder. Specifically, I got the latest issue of JAPA, JAAPA, the Journal of the American Academy of Physician Associates, March 2025, volume 38, edition number 3. They have a CME article in there titled "Evidence-Based Treatment Approaches for Adolescent Cigarette Use." So electronic cigarette use. So essentially vaping. So it kind of made me think about that a little bit. I think that's a huge, we've been kind of talking about some public health stuff on this lately, because that's been in the news. This is another one that's it's been an issue for a while, but I think it's a relatively new problem, specifically adolescents using electronic cigarettes and or what we call vaping. We'll refer to it as vaping from here on out. So some of the statistics and specifics I pull out of this article and talk about, just want to give credit to Lorna Solano, DMSc, PAC, again in the Journal of American Academy of Physician Associates in the March 2025 edition. So some specifics that I pull out of that, credit to her and her work. So bottom line, it's a big deal. Again, using the most recent data that we have, which is 2021, so it's a few years old. Interestingly, that data is coming from kind of the middle of the COVID pandemic, but approximately 34% of high school students in the United States and 11.3% of middle school students reported at least one trial of a tobacco related product, most of them electronic cigarettes. So, I mean, it's
a
30,
third,
30,
yeah.
yeah, a third of high school students and over 10% of middle school students. Those are babies,
Wow.
man. They're sixth, seventh, eighth graders. That's young. So it's obviously out there, and for whatever reason, it's become available. And so there's some unique problems with the electronic cigarette side of things in young people specifically. And so I just wanted to talk a little bit about that. So first and foremost, what are we talking about? Vaping electronic cigarettes. So essentially, you have an electronic device that has a small capsule. It's typically some sort of liquid emulsified product that can have tobacco. It can also have marijuana or other things in it, THC, and that liquid is heated up and then inhaled The original thought behind this, as these types of devices were developed, would be that it would be kind of this way for people to wean away from traditional tobacco cigarettes. And so it was actually thought of as almost like a health initiative. I don't remember if it was in our podcast or if it was in school or when we talked about it, but I remember actually kind of saying like, hey, this could actually be a really good thing because it could help people get away from cigarettes. Unfortunately, some of the side effect of its creation is that it's been made available to younger people. So essentially that's what we're talking about. The specific concerns with vaping for younger people is that it is readily available, it's easier to conceal, it doesn't have the same sort of like smells and that sort of stuff that like a traditional tobacco cigarette would. It also comes in a lot of different flavors that are maybe a little bit more appealing than just like straight up tobacco. I mean, there's like bubblegum and cotton candy and all that good stuff, peach ring, whatever.
Delicious.
Yeah, so I mean, it doesn't smell bad, it tastes good, and you can conceal it a little bit easier. I mean, you can vape almost anywhere you want to vape, and it's pretty hard for people to notice it versus like a cigarette, it's hard to hide that. So there's some specific concerns there as far as how easy it is to use. The specific health effects, in particular with adolescents, one, it can significantly, I mean, the biggest thing you worry about is the cardiovascular system and the pulmonary system. So the cardiovascular system, increased inflammation in the vasculature, which can cause all sorts of short-term and long-term problems. And then chronic inflammation in the lungs. Specifically, when we look at this, again, quoting from this article here, e-liquid aerosols are associated with direct harm to the respiratory epithelium, have been shown to alter pulmonary function, inflammation, mucillary clearance, and lung histology. So the mucociliary clearance, the little mucosa, the little fibers that help move things along in our lungs, start to stiffen and not work as well. So it has a harder time pushing things out, and so you get congestion in the pulmonary system. All of those
So,
are concerns for anybody, but they're uniquely a problem for adolescents. Sorry, go ahead.
but I was just clarifying that a little more. So you're saying like it's going to make it stiff, so that's going to make it harder for them to like cough, right? Is that what you're saying,
Yes.
or to
Yep.
like cough it up and get it
Correct.
out?
Yep.
Especially if you're
Get rid of
producing more of that mucus, right?
mucus.
Um,
Also impairs their immune response, so they're more susceptible to infectious issues. There's neurologic problems, and that's mostly just from the liquid, the emulsifiers in the liquid, not to mention whatever substance active ingredient is in it, nicotine or THC. Of course, with nicotine, we know it's an inflammatory chemical that can cause all sorts of chronic issues in the lungs and in the heart as well. It is essentially a two-pronged sword there, with injury from the emulsifier and the liquid and the delivery mechanism to get that chemical into you, as well as then when that actual nicotine or THC or whatever it is gets in, then of course the effects of that as well. So specifically what this article is talking, so that's kind of the groundwork of, okay, what are we talking about? Why do we want to avoid this stuff? It's readily available, it's easier to hide, it comes in fruity pebble flavors, and it uniquely affects adolescents and can cause significant neurologic, pulmonary, cardiovascular issues. So that's really the big thing. So then what the article is actually about is evidence-based treatment approaches for this. And so if you look at anything that we deal with, but especially something like this with addiction medicine is notoriously difficult. Is number one, you have to identify that that's a problem. There is sort of this idea that addiction is sort of a personal weakness or a mental weakness, in my opinion, and I think hopefully most of medicine's opinion. Addiction is a disease. It is a chemical dependency. So you have to identify and assess that. There's multiple different ways that can be done. It's usually assessed with some sort of checklist. So it's reliant upon patient report, which is inherently flawed in that people lie and they underestimate how much they're
no,
affecting it. Yeah.
people lie.
I know.
No, I
Actually,
don't.
maybe we should have led with that breaking
Yeah,
news, people lie, particularly to their healthcare provider, right?
yeah,
Shocking.
yeah.
But there's a handful of assessments. You can use the Hooked on Nicotine checklist. There's a what's called the EDS, the Modified Fagerstrom Tolerance Questionnaire. So there's all sorts of different ones. The Hooked on Nicotine, or HONC, is the one that I've heard of and used. It's pretty basic. It's essentially a questionnaire with 10 questions. It's relatively quick. It's done usually at an intake of a primary care visit, and essentially just asks questions and helps to determine the degree of tolerance. So how bad is this? Once you decide how bad it is, then you talk about kind of what are the interventions. And essentially there's three main things. Number one is behavioral intervention, which we'll talk about. Number two is pharmacologic, and number three is combination. Behavioral, it's essentially understanding that it's bad, which hopefully most people do, but in public health you can't take any of that for granted. So you have to make sure you understand this is bad. This is not something you should be doing. This is why it's bad. And here's the reasons why we would recommend you avoiding this type of thing or stopping. In that comes avoidance. And so trying to make sure that people don't ever start using this stuff so they never end up with some sort of substance use disorder. Motivational interviewing, which is essentially a specific way of kind of asking questions and leading people down the road of them understanding why this is bad and that why they should work towards getting rid of it. Contingency management and cognitive behavioral therapy, which are both, usually not done from the PA perspective. That's usually us prescribing that so they can go see a counselor and work on addiction treatment. There are counselors that specialize in addiction management and addiction treatment. So I think that's really the bedrock and the foundation, and hopefully typically the most long lasting solution is to get people talking to someone that can help them work through this and try to help reduce triggers for what would cause cravings and that kind of thing, because obviously addiction is difficult to deal with. That brings us to the second part, which is pharmacologic treatment. So I'll bring you in here a little bit more, Chris, because I know you've been looking into this. Essentially, there are two main medications out there to use to treat it. There is bupropion and varenicline. Bupropion and Chantix is the brand name of the varenicline, if you've heard of that. So do you want to talk about kind of the uses of both of those, particularly with adolescents? That's really kind of what's outlined in here. Talk about the mechanisms and that sort of thing with those two.
Yeah. So bupropion is a norepinephrine dopamine reuptake inhibitor, an NDRI, and a nicotinic receptor antagonist. So this is going to increase their norepinephrine and dopamine in the brain and help regulate their mood, which also helps with depression. And then Chantix blocks the ability of nicotine to activate the alpha 4 beta 2 receptors and thus stimulate the central nervous system's mesolimbic dopamine system. So that's fun. So they're not getting it stimulated from the vape or the nicotine within the vapes themselves. So that's what they're doing. And it reduces that underlying reinforcement or reward experience from vaping or smoking.
Yeah, it just makes it feel less great, right?
Yeah.
You don't get that same response.
Yeah. So
Yeah.
so again, reducing that behavioral connection from the vape. You're just like, oh well, if I'm not getting the same high off of it or the same stimulation, that we'll probably stop using it, right?
Right. Yeah. And so I think I've seen both used in practice. I think just anecdotally, this is just me. Bupropion tends to be the first because it's relative for, and so to issue along with the substance use disorder, and so their addiction to vape pen or cigarettes or whatever it is. There's usually something along with that. So the bupropion is really nice because it's a little bit better tolerated. It's a little bit less expensive than the varenicline, and it kind of kills two birds with one stone. Helps with some of the mood stabilization and the depression side of things, as well as hopefully curbing your cravings and that sort of stuff. A little bit less expensive. It's still not cheap. In this article here, they quote that approximately $60 for 60 tablets, which is usually a once a month, so about $60 a month for the bupropion, depending on your insurance and all that, versus the Chantix, the varenicline, about $150 for 60 tablets, which would be the treatment. Treatment duration is about the same. Bupropion, you want to trial for 7 to 12 weeks, and the Chantix is about 11 weeks. So in the long run, the bupropion is going to be less expensive, and I think it covers two things a little bit better. So to me, the varenicline would be your second line. If there's anybody that's in primary care or addiction medicine watching or listening, and you have a different thought, please let us know, because neither one of us are specialists in that area. But anyway, so so those are the two pharmacologic options.
Yeah, and one thing about the Chantix for sure, I've certainly ran into patients who've had the weird or vivid dreams on that, and that has been a turnoff. That happens pretty early on in treatment, and so that might be another reason not to have it. I'm not saying that happens to everyone, but I've certainly run into patients that have been like, well, I just had crazy dreams being on this medication, and so they were like, I just don't like it because I dream so vividly.
Well, yeah, sort of, you're taking away something that their body likes, right? You're getting rid of that nicotine boost or whatever it is they're feeling, and then, oh, by the way, we're going to make you sleep terrible and feel weird. So it's not well tolerated. That's kind of, I just have not seen a lot of significant success with Chantix in adolescents. In adults, I think it's a little different, but in adolescents specifically, bupropion and having that extra neurotransmitter effect, I think, is typically better for most patients.
Yeah, as it goes for, so maybe some of those, I know we're talking about vaping. What about those children or kids that are actually doing the cigarettes? And I mean, would you recommend, I guess, vaping over cigarettes, or just what are
No,
your thoughts?
I mean, I think in public, again, in the public health realm, I think the idea would be no, get rid of anything that you're taking in that way. I think if you're having a more practical conversation with a patient and you're in the room and they're telling you, look, I don't think I'm going to be able to stop completely. Sure, I guess vaping would be a slightly better alternative. The things that come to mind, the secondhand effect of it would be less. I think there's still research sort of pending as to how much. I think there's probably still some secondhand effect from a vaping emulsifier pod being burned, but I don't
Yeah.
think it's nearly as significant as the secondhand effect of tobacco. And so if they have friends that don't vape, or they have younger siblings, or they, whatever, again, living in the adolescent world for this talk, that would maybe be a better alternative because you don't have the secondhand effects. You're not messing up other people's lungs and heart. But I think in general, it would just be better to just say, I would not use any of this stuff. But that's where the art of medicine comes in, and having a conversation with your patient, and frankly being realistic about things. I mean, I think the longer you're in medicine, the more you understand that big changes are really friggin' hard for people, and you need to have interventions that are practical. So I suppose, yeah, if they're pounding a pack of Marlboro Reds a day, switching over to a switching over to our Camel
Those
Unfiltereds or
100s. Yeah.
whatever, yeah. I mean, switching over to a vape as a measure to try to work towards weaning off, I guess, is better than continuing to smoke cigarettes? Question
Yeah.
mark. But
Yeah. Well, I think as you're saying, as well, like the social aspect of it, that's probably how they got into it to begin with.
yeah,
And yeah, I think changing that or the friend group might also be very difficult. We've certainly seen that with other addicts and things like, they might get clean or go to rehab, but then they get back in with their same friend group and then they end up using again, and they're just on that cycle because they're around it, right? So
right.
I think
Yeah,
that's a very
triggers.
difficult. Mhm.
And that's where that cognitive behavioral therapy and work with an addiction specialist comes in, of kind of understanding, one, how to deal with it when it comes up, because inherently it's hard to avoid it completely. And then two, understanding your social group has a huge impact on you personally, and making sure you understand how important it is. And I mean, when you're talking about rehab, you're typically talking about harder drugs, but even with nicotine and THC and vaping and all that stuff, trying to limit the number of triggers, trying to understand your social circle, and either removing yourself from that, or trying to reason with the folks that are around you that are maybe still using that, saying, look, this is important to me. If you're my friend, you need to knock that shit off, or whatever.
Yeah.
And so then that brings me to the kind of the last point that will kind of let us wrap up. And that really, as with most things in medicine, a combination therapy or a combination approach statistically and based on evidence tends to be the best. So just behavioral therapy alone or just pharmacologic treatment alone does not seem to be as effective as a combination approach. They talk about in here, there's some ways to try to harness technology. So they have some apps and some technology based approaches, texting and that sort of thing. It's almost like providing a sponsor either digitally with an app or through a text to help kind of work your way through that, trying to work your way away from those sort of things and managing your triggers, and using school-based programs or public health programs. For example, in the state of Wyoming, where I'm at, we have the Wyoming Quit Line, which helps with pretty much any sort of tobacco-based issue, and they can provide resources and nicotine replacement and blah, blah, blah. Yeah. So
Nice. Love that.
there is one other thing I found very interesting. They do mention transcranial magnetic stimulation, or TMS. Uses magnetic devices placed on the surface of the head, typically tangential to the scalp. They did some studies and felt like it did increase the odds of abstinence, meaning how well people would refrain from use. They essentially felt like after the study that duration and intensity may increase the effect for long-term smoking cessation, but further research is needed. So they're saying they need to figure
Yeah.
out to what extent and all that. So that's interesting. That's kind of, that would be somebody that's really struggling before
Yeah.
I would start talking about TMS, and I don't even know who would do that. Maybe psych.
Yeah, I was like, definitely, yeah, something like that. That I'm seeing, things about psychiatric disorders. So it's like, is this the new electroshock therapy?
Yeah, I mean, I've seen
You
that for
know,
depression and that sort of stuff.
yeah, and that's kind of what I'm seeing about this, and that's kind of what it sounds like. Like they just almost like they relabeled it.
Yeah.
Again, I'm not. This sounds much safer, met with a magnetic stimulation rather than actual electricity, right?
Yeah. Yeah.
So that's
So
nice.
anyway, it's just another that to me would be kind of the, the tertiary option. You've tried the behavioral intervention, the pharmacologic intervention, the combination intervention, and you've tried it for an extended period of time and you're still not getting anywhere. That would be something that you could maybe refer on for folks, and trying to keep it from the PA perspective. That's going to be something where you're sending them to a psychiatric provider, would be my guess. Have tried a lot of the other things before I jump into TMS,
Yeah.
transcranial magnetic stimulation. So anyway, bottom line, it's a good thing to work on and identify, to understand that this is out there, to understand the prevalence of it, and understand why it's so easy for people to get started and addicted to this, particularly in adolescence. Understanding the relation between mental health and substance use disorders, understanding that there are both pharmacologic and non-pharmacologic interventions that can help, and understanding the importance of why we should continue to get on our soapbox and harp at people about smoking cessation and tobacco use cessation.
Yeah. It's just not good for you. It's just not
It
good
ain't
for you.
good, man.
Yeah.
It ain't good
It's
for
not
you.
good. So,
No. Okay. Well, I think that's all I got for today. Anything else to add, Chris?
no, that's good. Go get them, man. That was good stuff.
Yeah, go get them. So we got the mug giveaway. That seems to be pretty popular. So keep sharing that with friends and family. We will be drawing that on the 20th, so in a week. So keep it rolling, keep it rolling. We'll pick somebody at random and send them some free stuff. We have some other stuff. We got t-shirts, we got more mugs. If there's other stuff you want us to provide for these giveaways, shout it out. We'll see if we can make it happen. Otherwise, check us out on Instagram, Campfire Med Pod. Check us out on YouTube, Campfire Med Pod, and then like and subscribe to us wherever you get your podcasts as well. We really appreciate all the fan support and the followers. I'm trying to keep this thing going, hopefully providing some fun and educational information for PAs and everybody else as well. Send us a DM if you have any other questions or if you want us to cover something specifically. Otherwise, that's all I got. Okay, I'm tired of talking.
Yeah.
Let's get them out of here and let them go get them.
Go get them.